Hey, welcome to the Travis Perry Show. Today, I am just fortunate to have a friend in studio with me, Dr. Spencer Wade. He is a practicing chiropractor of 16 years who specializes in advanced posture correction with a background in biomechanics and is just an all around great guy. Welcome to the show, Spencer. Appreciate you being here.
Absolutely. Thanks, Dr. Perry.
Yes, yes. So talk to us a little bit about how you became Dr. Wade. Talk to us a little bit why chiropractic, a little bit about, your background story.
You bet. People love to hear that. Even my patients ask me, like, why did you choose to become a chiropractor? So it's good to have a story behind it. I went to school actually with somebody, a nice guy from Canada, and I remember asking him, so why did you decide to become a chiropractor? Like asking him, like, what's your story? Have you had crazy amounts of pain? The guy said, I just knew somebody who's a chiropractor seemed like a good life. Well, have you had back pain? No, never have actually had any pain. But yeah, I've always wondered, man, what would it be like to be a chiropractor if you didn't have like the story that drove you into chiropractic? So yeah, I do have a story. I was a sickly kid. I wasn't very well. I was that child of my mother's seven kids who was fraught with all kinds of medical health problems. And I just figured it was just genetics. I had asthma and allergies. Doctor told my mom I was allergic to everything but rabbit meat and venison through skin prick, IgA antibody tests. And I was a headache sufferer, and it's really those headaches and still, to a degree, headaches that continue to be the focus, my personal health focus in life. When I was older, about 20 years old, I was in a head-on collision, and that messed me up. I mean, such that if I didn't get 8 hours of sleep, I'd land myself a giant migraine. And when I ask my patients, hey, of your back pain, your neck pain, your wrist pain, and your headaches, what would you like to see disappear? If they're truly a headache sufferer, they always say they're headaches. Anyone who really is a headache sufferer, it's not like having your shoulder hurt. It's like if you have a headache, you're dysfunctional, like physically, mentally, emotionally, you become a handicap on all those levels. So after that head-on collision, those headaches got really bad, and I had some exposure to chiropractic care, and I sought out more, and I was getting relief from it, but it wasn't really fixing the problem. One chiropractor where I had liked his touch and his bedside manner. It was very professional. He had taken x-rays of me, and I asked him, hey, um, so what do you think is wrong with my headaches? And does that have anything to do with my spine, my neck? And he showed me a side view of my neck, and I had just like a ton of like forward head posture. I wasn't aware of it at all. But he said, yeah, that's a lot, and that's going to be a huge added strain to your body. And of course, then I asked, well, what do we do about that? And he said, well, that's just how you're born. And of course, I was like, oh man, and my heart sank. So I have this big problem, and there's really nothing to do about it. And really, none of the chiropractors ever had that proactive conversation with me where you and I formally were talking about this idea like, are you a proactive or a reactive chiropractor? And I am proactive when it comes to health. And it was a year or so later, I came in contact with a different chiropractor, a different approach, different methodology. And that's who really opened my eyes to the shape of my body. We call that posture, the structure, and how that's impacting my health, particularly by way of headaches. About that time, I remember I saw a side view picture when we used to develop photographs back in the day before digital cameras. And I was fly fishing in a river in Colorado. And I remember looking at that picture thinking, oh man, like that chiropractor from long ago is right. And this newer chiropractor I met is right. Like my forward head posture is like outrageous. And from that time, I was considering chiropractic as a career, and I was shadowing this guy with this new methodology I hadn't heard of called chiropractic biophysics. And it really changed my perspective about chiropractic. It allowed me to start thinking in a proactive manner, allowed me to start thinking about not just a bone being out of place, but maybe like my whole spine is out of place. And so receiving treatment there and then shadowing, and then I worked for him in the office. I had exposure to this stuff long before school. Then I finished my undergraduate degree and went to a chiropractic school that taught these methods in San Francisco, in the Bay Area. And then I got out of school and I was kind of the club president and I really focused in on this posture stuff. And I flew around the country a little bit to get additional training certification. And then I left when I graduated to go to Washington State, where I practiced with somebody there. And then upon finishing up an internship, more or less, my wife and I decided to relocate closer to family, and we landed ourselves here in Cache Valley. And I don't think we're going to go there maybe today, but all the while, I've also been a student of nutrition, and my studies in nutrition have paralleled my studies in spinal health. Like, what are the root cause? What are the drivers of dysfunction? So I've studied nutrition all along too. And in Cache Valley, my in Utah here where we are, my perspective on spinal health has been again focused on this idea of posture. And I think we've really helped a lot of people in some big ways. And it's not always just the methods I have here. It's waking people up to their day-to-day habits that are deteriorating their health, and oftentimes people are entirely unaware.
Yeah. So great. Thanks for sharing. I have a story. They brought me to chiropractic a long time ago. But we won't get into that today. It definitely has opened my eyes to what's going on with them, with this connection. Like I'm very big in balance, but time balance and an area of life sort of thing. But physical balance is very important. To have that posture is super important. So talk to me. What would you say is the number one worst habit that people get into that creates poor posture?
So it's surely being at a workstation, I think, for most people. No doubt electronics are huge, but let's just say workstation posture. Um, I have had patients through the years that are involved in some activity. Let's just say, for example, they're a dancer or something. There's certain things that tax our bodies, and we can't really fix them, but we do have control over the things that we're doing day in and day out, our workstation, how we drive, how we sleep. And knowing that people's workstations are just a wreck and they're sitting at this thing for 8, 10 plus hours of a day and it's all wrong. Yeah, it's a wrecker. In fact, yesterday I delivered a health talk, a presentation on posture and ergonomics at a business. And one of the person who invited us, upon finishing my presentation, he said, "Hey, can we just like dart into my office so you can look at my setup in there?" And see, I know the shape of his spine, and I know his health history. And then when I look at his ergonomic setup, like bingo, it wasn't just happenstance or just coincidence that his spine is shaped the way that it's shaped. He showed me what it looked like, and by his own admission, he knew it wasn't perfect and was going to need some help. But his very setup was creating a dysfunctional shape that, in fact, was interfering with his love, which happened to be mountain biking. Um, and so he's that kind of guy, though, even though he's not been awakened to these things his whole life, but he's very proactive. So
Nice.
immediately, like he's going to address all this stuff, fix it.
Yeah. Well, it hits home. I mean, I've got an ergonomic desk, a keyboard that comes in and out, like I can lower and raise it however I want, a microphone that will go where I need it. I've got an ergonomic, chair. I've got the treadmill. Like I've got all these things because I've seen this in my life, and I happen to be a mountain biker. So like that's what I care about. But mountain biking is not great for posture. Pelvic tilt issues, all sorts of curvature problems that I'm finding. Oh man, I've been doing this for so long. I've got to get back to it. But clearly, most of us business owners, especially I'm working with, are spending way more time at their desk, right? Than ever before. The laptop posture, the hunched over for the phone, all those things. I absolutely relate to that, and I bet a lot of other business owners relate to that. So why don't you tell us a little bit about what your formula for fixing this is? What are the steps that you suggest for people, or that you use in your profession to help with posture correction?
Right. So I'll talk about the clinical steps in my office, and then I'll talk about the steps that should exist outside of my office, right? And in one's day-to-day life. So firstly, one needs a proper explanation as to what their posture is. I'm a fan of movement and exercise and stretching, but a lot of people do posture related things because their instructor, their yoga or Pilates instructor, somebody told them. But they're really just kind of arbitrary suggestions that aren't personalized to the shape of the person. For example, somebody might be in yoga and they're told by their instructor, "Hey, we got a pelvic tuck, right?" And if you're a woman, especially, all of us probably, but especially, they're like, "Yeah, I pelvic tuck." Because I want a tight core and a strong body. But pelvic tucking is actually predicated upon whether or not one has too much or too little low back curve, their lordotic curve of their low back. So in fact, one person pelvic tucking is beneficial for their health because it is driving the curve of their back more to a natural neutral, whereas on another person, pelvic tucking is actually wrecking their back like bad, like enough that I've had patients that are facing surgery. I had a lady that she was receiving surgical consultation because she had just been an incessant pelvic tucker. And even just a couple weeks ago, I had another person in my office and I looked at their x-rays and I said, "Oh, you've been a pelvic tucker, haven't you?" And she was like, "Yeah, how can you tell?" I'm like, "Because you're getting arthritis. Because you're not somebody who should pelvic tuck and you're doing it." Like, well, what do you mean? Well, you've had a flattened low back curve, but you want a tight core and abs, and so you pelvic tuck. Um, and so a person first needs to know this stuff. Now, it's very hard just by looking outwardly. Really, somebody should go find somebody that has some background in this, and they should be shown, like, do I have too much or too less? There's a lot of other considerations just outside of pelvic tucking too, like neck posture, especially as it concerns the workplace, super important. Nobody needs to be staring down too much. That's bad for us. That is so detrimental to somebody who has no curve in their neck or has a reversal of curve. Most people in general are going to be benefited by everything being higher, at least by way of their neck posture. Um, there's other considerations. Symmetry. Sometimes people are asymmetrical. They don't realize it, but let's say like one of your monitors is it's to the right, and that's your dominant monitor. And so that you're like this. Well, in time, the person's literally going to develop like a rotation in their neck where they're stuck. Or they're going to develop like a lateral shift like that. We call it translation on the x-axis. They're going to be shifted like that out of their midline. People formerly stuck on a phone like this, where they did this for many years, a construction worker carrying like all of his weight on his right side. So again, you need an appraisal first of like, where are you at? Like, am I a symmetrical human? Do I have appropriate curvature in my body? So that's number one. Once they get into my office, we do three, four different things. We do regular chiropractic adjusting here, whatever methods work for the person, drop table, regular manual adjustments, osseous breaks, whatever you want to call them, activator, upper cervical work I specialize in. But we use what's called mirror image principles. So I adjust people in the mirror image, meaning I know how their spine is shaped, and so I adjust them, putting stimulus into their body, the direction of correction. Then we teach people posture exercises. And the posture exercises are also in the mirror image. So if you're crooked one way, well, we're going to exercise you opposite the way you're crooked. And then lastly, we use traction. And it's not traction like people would imagine in a hospital or at their physical therapist. We're literally using different machines, ropes, pulleys, and weights to create bending motions in the spine to induce changes to the shape of their spine. And that is done to change the ligaments. And that's a game changer for people because like a neck, let's say there's not curve in one's neck. There's little to do actively by way of exercises. Like if somebody doesn't have a curve, they have to do traction that'll change the ligaments so that they can have a new shape to a neck. In fact, I have a friend who he became a patient and we worked really hard on the shape of his neck, but based on some complexity of the shape of his neck, it was really hard to put curve in his neck. And then he went mountain biking and then he landed really bad and he didn't have a curve in his neck. And so guess what happened? He herniated discs because no curve in a neck and then an impact injury like that, one is actually more susceptible to disc herniation because curves engineered by God in our spines are what are protective against a load-bearing situation. And not having that, he herniated disc. So kind of a
Wow.
crazy thing.
I mean,
And then he got,
that hits home. That hits
yeah, it's
home. And I've done some traction with a chiropractor years ago, but I found that most chiropractors don't know how to do it. Have never been trained, and so it's been one chiropractor years and years and years ago. Who talked about it, and I've seen and actually have used some at home kind of traction ish devices. It's more of like a a pad underneath to try to correct that. And maybe there's pros and cons to that, but I like that you have some chiropractors, they just do adjustments. Let's come in, let's adjust. It feels good while you're there, or maybe it might hurt while you're there, and then you leave, and then you got to keep coming back, and it's like it's never, is it ever not aligned? But you're doing exercises with that, which I found to be extremely beneficial as someone who really cares about his own health. And then traction, like yeah, having these three these three steps together, you've seen some great results with this, or is there any other steps involved in this protocol?
those are the main things. I give my patients a posture questionnaire so that I can help them identify what the stressors are in their life so they can come back to me and we can have a conversation. Those are the main things. Outside of my office, the day-to-day things, yeah, I think my patients should be doing just as you described. And frankly, when they come in and I say, hey, here's how we do it here, I want to see you 3 times a week, and I'm going to see you for like weeks and months, not everyone wants to sign up for that. And I get it. And I'm willing to work with people, even if they just are doing something on their own. And I tell them that. Tell them, look, if you're willing to do anything, I'll help you. So long as we both agree, hey, the shape of your spine, this is a problem. Do something about it, anything. And so, yeah, there's some great tools out there, little things you can lay on. The one that's popularized it all is called the Denerol,
That's
Dr.
right.
Jeb McAvney and Deed Harrison, these people that made this thing out of Australia. That is unique to my technique, chiropractic biophysics.
Cool.
But
I
from
that's the
that,
one that I use. That's great.
yeah. Yeah,
Yeah.
and that's kind of the original. And now there's a gazillion, different ones on Amazon, and I think some of them are pretty good. But yeah, there's things to do for lack of curve in a neck that you can lay on at home, or for the low back, even the middle back. There's definitely things to do. There's exercises people can do at home to try to create curve in their neck. They're all helpful, and I believe that the more my patients do those things, really the less need they have for adjustments. I know it,
Yeah. Yeah.
and I'm happy to tell my patients that, which some would say, well, that's not really going to create like a future patient. But again, it's that
It'll create
proactive
referral.
referral.
Yeah.
Yeah, that
I'll
referral.
refer people to you because it's not just the one or the other, right? It's not just coming in for a chiropractic adjustment to feel good temporarily. So I think people appreciate that. It's like the dentist that hands out candy at Halloween. Like, what? No, I appreciate the dentist that accepts people's candy and pays them money for it. Like, it makes sense to me that they're being proactive about the actual holistic health. So I think I appreciate that. I love that. What would you say is the one thing that maybe a misunderstanding or something that keeps like a hurdle that keeps people from actually having really great posture?
Yeah. Um, yeah, that's a great question, and maybe still conjures up in me the things, your former question where like what can people be doing? Like how does your recipe work? And then what can people do on their own? Yeah, if a person doesn't go there, start considering how do I remove the bad and add the good, then they're going to find themselves in the same place. But again, it's the information age and it's probably phone use that is the biggest wrecker. Um, because almost none of my patients have a curve in their neck. And we measure this stuff in degrees, and ideal is 42 degrees. Being in the 30s is optimal. All the studies say that less than in the 30 degrees, it's a risk factor for chronic neck pain and headaches, jaw dysfunction, numbness and tingling, neurological stuff, all kinds of things. So most people, again, they just shouldn't be spending time staring down for hours and hours on end. And phones are probably the biggest, newest culprit, but that's not to exclude laptops, just their regular workstation. The biggest consideration is how high is your monitor, you know? I kind of I'm a tough critic of like ergonomic specialists, they're talking about like 90 degrees at the upper arm and the elbow and your wrist at 15, and all these things like that's nice. Those are cute. How high is your monitor? It's the number one.
Yeah,
It's
because if the
number one.
monitor is up here, that creates a weird effect. If it's also down here, you're looking down at a laptop all day. That's putting
Yeah.
that pressure on the neck.
Yeah. And some people are just not going to find that really comfortable. But yeah, for most people, the higher the monitor is, the better off they're going to be. And I had a patient who was this big guy, middle back pain, not even neck pain, but his workstation was on his laptop in his car because he did field work. So he came in to see me like, oh yeah, doc, I got this middle back pain. I used to see this guy over here, he'd just do the old and crack me and that'd take care of it for a little while and then it'd come back. And so I said, okay, well, how about we investigate your posture? So when he allowed me to x-ray him and look at him, I said, well, let me tell you something. Your problem has nothing to do with your middle back. It's your neck. And I said, I know it's your neck because I've seen it on x-ray and I know what you do in your car staring down on a laptop. So we did the things that we do here, and of course, expected that he was addressing the stuff outside of here. And do you think he had any middle back problems after that? No,
Great.
he didn't have any.
That's wonderful. So what would you suggest for those, busy business professionals, business owners? What would be the one or two things you would say do now? If they're local, obviously come in and see you and they can find you there. But what's something they can do today, right now, right after this podcast?
Well, for one, like I mentioned before, if a person does have x-rays from anywhere, the hospital of their spine, go back and look at them and see, yeah, do I have a curve in my neck? It's so important that it's been called the arc of life, that naturally everything downstream is affected when you don't have appropriate curve in your neck. So look and see. And then for most people, and especially your constituents, consider your workstation and really look at your monitor height. Having a sit stand desk or a variable height workstation, that's all good. A ball that creates movement, but just ask that question, where's my monitor and how do I get it a little bit higher? For most people, they're just going to do so much better long term the higher their monitor is.
Yeah,
Maybe
well said.
phones, if we could talk phones, but even I, still have to remind myself regularly
Yeah, I mean,
to,
most people, I call it Down syndrome. Like they're always looking down at the phone, but you really have to be thinking about it, like to look at it up here. That takes work. Like that's effort. You got to be
yeah,
thinking about that.
there's a couple factors there that drive that. And one of them you mentioned, it's the fatigue factor. People don't hold their phone out here because now you're holding the whole weight of the arm. The other reason that people don't do that is there's more ambient light in the like on the horizon than when you're staring down. So if you're trying, for contrast reasons on your screen, people hold it low because the floor is darker. And so yeah, it's a struggle, but I teach my patients, hey, at least, for the fatigue thing, plant your elbow on your torso. Okay? Because if your elbow's on your torso, then you're not going to feel that same fatigue and you're still going to be staring down a little bit, but not like having your
Not
head
like
bent
that,
in your
for
in your
sure.
lap. So
Yeah.
that's a real easy one to do right there. Plant the elbow on the torso. For, the contrast thing, that's just a hard one.
Yeah.
You know.
Yeah. And yeah, and screens, they're bright and everything anyway, but technology is getting, I guess, better and better for that. Well said. if you put this all together, it's one thing to come in with pain, it's one thing to come in because something's hurting, um, but it's likely people have experienced this pain over a period of time. It's likely that it comes on and off. Um, to bring this back to just normal, everyday, functional health, why would you end with this idea that it's the arc of life? Maybe expound on that a little bit before we end today.
Sure. Yeah, structure determines function. So when you have altered shape in the structure shape of the spine, then there's altered functionality. Chiropractors, in fact, study almost as much neurology as they do skeletal anatomy, which isn't to say they maintain and keep all that through practice, but we study it a lot. You can't have disrupted shape to the spine and expect the nerves to work right. There's not only susceptibility to arthritis and herniated discs, but there's other concepts that exist out there called cord tension. Literally, the spinal cord is put under tension. The nerve roots are not in optimal positions. And this whether it's the autonomic nervous system or whether it's whether it's just the physical stress on the neck, you're going to have dysfunction in your body because not just the structure is altered, but the nervous system is altered through having a disrupted arc of life. So if you want normal spinal health and avoid back pain and neck pain and headaches and all the things, yeah, you have to kind of look at the bigger picture and not just strictly ask, am I flexible and can I move and can I bend? And you have to realize that the structure is very important.
Well, this has been a pleasure to interview you today, to have you on the show. If people here are local or if they're in town or they're close, what's the best way to find you, to reach out to you, to get into your office to start, getting these
Max has
x-rays
been
done?
here, 13 years, 14 years, Integrity Chiropractic in Providence, Utah. So we're easy to Google and
Thank you for your time today. I really appreciate having you on the show.
you bet. It's been a pleasure.
Absolutely. And if you've enjoyed this as much as I have, having Dr. Wade with us on the show, enjoy our other episodes. Stay, tuned to future work that we might be doing together, but also other episodes we have on the Travis Perry Show. And until next time, remember, live life on purpose together.